overall context of what we're doing. Every day we go through the daily updates, but again, it's important that people see and understand the overall context of what is going on. What is all this about? What the United States is doing, what they're talking about in Washington, what we're talking about here? Slow the spread of the virus to a rate that the healthcare system can manage. Slow the spread of the virus to a rate that the healthcare system can manage. You are not going to stop people from being infected. There are all sorts of percentages about what percent of the population will be affected. 40%, 50%, 60%. You will not be able to control that. Nobody thinks you can. But you can make efforts to slow the spread, because the real question here is, can your healthcare system manage the influx of patients? That's all this is about. And China, South Korea, Italy, it's the same lesson over and over and over again. You get into trouble when the healthcare system can't manage that rate of intake. So try to slow the spread so it equals your capacity in the healthcare system. What do you do to slow the spread? Test, 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 test. We've made great progress on testing. The President's agreement to allow New York State to do its own testing is very important. We need more federal assistance in allowing what's called automated testing, which the FDA still controls. Roche is a company that does automated testing. The President made an announcement with them, but it can't just be a couple of companies for the United States of America doing automated testing. We need more automated testing. What does that mean, automated testing? Manual, you put the test tube in the machine. Automated, everything is robotics. It goes from 30 tests per day to 1,000 tests per day for a laboratory that can go from manual to automated. So that is a tremendous difference, and we need more help on that. How else do you slow the spread? Density control. This awkward seating arrangement that we have here today reflects two things. Number one, that the LCA doesn't work on Sundays. Number two, spacing out the seating, reduce the density. So reduce the density the best you can. Those are both slow the spread strategies, okay? What does it mean to slow the spread? This is Dr. Fauci, great New Yorker, by the way. You see everyone in Washington looking at the charts of the curve. Flatten the curve, reduce the rate. So the high point of cases is reduced so it can be managed by the healthcare system. That's what they're talking about. Flatten the curve, flatten the curve. Why do you want to flatten the curve? Because the curve is not a curve. The curve is a wave. And the wave could break on the hospital system. That's what they're talking about when they're talking about the curve. If you have too high a number of people sick at the same time, when they descend on the hospital system, you will overwhelm the hospital system. That's the issue here. It has always been the issue here. Overwhelming the capacity of the hospital system. And that, my friends, is important. You know, you listen to the cable news all day. Well, why didn't we start testing earlier? Why weren't we more prepared? That's all about yesterday, right? That's all recriminations, that's blame. We should have done this, we should have done that, we should have done this. I'm a governor. I am here today. I'm focused on what I need today to prepare for tomorrow. And that's what everybody should be focused on. You want to do a retrospective on who should have done what, when, and who's to blame? Put a pin in it and do it afterwards. Let's be constructive, which is focusing on today and tomorrow. There's an old military expression that management officials use, don't fight the last war. This is not about what happened yesterday. We are looking at a new war that no one has seen before. This is a case of first impression for this nation. We have never fought a virus like this with this potential consequence. So plan forward, plan forward. You see that wave? Try to reduce the size of the wave. Assume you can't reduce the size of the wave. And assume the wave breaks at a higher level than the hospital system can accommodate. I believe that's what's going to happen. So, what do? New York State hospital capacity, 53,000 beds, 3,000 ICU beds. Is that a lot of beds? Is that little beds? 3,000 ICU beds, presently about 80% occupied, okay? So that means you have several hundred ICU beds available. Why are the ICU beds important? Because the people who come in, vulnerable populations, older people, underlying illnesses, respiratory problems, they need the ICU bed. They need the ventilators. They need the machines that breathe for them. Those are the ventilators. They are in ICU beds. The overwhelming crush is going to be on the ICU beds, not the 53,000 normal hospital beds, because those are basically going to be people recovering from the flu. You can recover from the flu at home. If it's really bad, you go into the hospital. They make sure that you are not dehydrated. But the critical people are the people who had underlying illnesses and need those ICU beds and those ventilators. 3,000 goes very, very quickly on any projection of these numbers. What do? Maximize existing hospital beds and hospital capacity, potentially build more capacity. Again, we're only talking about several weeks here before that wave breaks. Potentially build more on the existing hospitals, provide more staff, identify backup staff. That's why we're going to medical schools, retired nurses, retired doctors. Develop a reserve staff because healthcare workers will get sick. And when they get sick, they go home. You want to limit the hospitals, limit staff. That's the way you limit the hospitals. Find doctors who are on reserve and purchase the necessary equipment. What makes an ICU bed an ICU bed? Primarily the ventilator. These ventilators are expensive to begin with, and they are scarce. And you can't find available ventilators no matter how much you're willing to pay right now, because there's literally been a global run on ventilators. And free up beds that are in the hospitals. How do you do that? Two ways. One, we may get to a point where you cancel elective surgery. You can have your hip replaced next month, not now. Or develop another facility that you can move people from an existing hospital bed who don't need intensive care into a different facility. How can you build more hospital capacity now? That's a great question. It has never been done before. It takes years to build a hospital. It takes years to convert an existing facility into a hospital. It's billions of dollars. It's a workforce in the thousands. But on the theory of try everything, an area that we have to explore is, can you build more hospital capacity now? I'll get back to that in a minute. On the reducing density, slow the spread by reduced density. I've been talking to private businesses all across the state. I am asking them to aggressively consider work-from-home strategies. I'm asking them to aggressively consider voluntary closings to help reduce density as a social responsibility to protect their workforce. But I want private businesses to aggressively consider work from home and voluntary closings. Depending on what businesses do on a voluntary basis, we could consider mandatory actions later on. We've already taken mandatory actions. No large gatherings over 500, 50% of legal occupancy of a facility. That is a mandatory way to reduce density in the workplace. I'm asking them today to voluntarily consider closings and reductions in workforce. If need be, we can calibrate up the mandatory requirements that I have already put in action. How do you calibrate it up? Rather than 50% of occupancy, it could be 40% of occupancy or 30% of occupancy, et cetera. I'm not doing that at this point, but I am asking businesses to aggressively consider these measures. If the private sector does not respond voluntarily, if the spread does not slow, then I would increase the mandatory guidelines. For New York State government, lead by example. Lead by example. All non-essential personnel in the state are asked to stay at home from Rockland County south. That's about half the workforce of the state in that area. Why Rockland County south? That is the area of highest density of the number of cases. Remember again, the number of cases varies widely across the state. You're calibrating your actions to the data, to the science. You should be doing different things in New York City than you're doing in a county upstate that only has 1 or 2 cases, right? This is a calibration by science to the facts. The New York State court system congregates many people, tens of thousands of people all across the state. I spoke to the chief judge. I asked her to come up with a plan that keeps the essential services operational, criminal justice services, emergency family services, et cetera, the essential services available, but non-essential services, actions that can be postponed, to postpone them. Again, reduce the density coming into the court system. I'm asking private businesses to stay home. Reduce the density coming into the court system. Don't jeopardize the criminal justice system. Don't jeopardize safety. Don't jeopardize family integrity. But if it's non-essential, then postpone it, and then come up with a plan that reduces the courts to follow that concern. The chief judge is a total pro. She is not just a great jurist, she's also a great manager. She's managed large operations before, and all of her skill and tenure has been on display here as the chief judge, and she's ideally suited to do this. I asked her to come up with a plan tomorrow that she will announce on the specifics of how she'll implement this. How else do you reduce density? You come to the issue of schools. Should we open schools, close schools? A number of Schools have closed. We've added Jim Malatras. You all remember Jim Malatras? He used to work here. He then semi-retired, went to academia. He doesn't consider it semi-retirement, but I like to irk him that way. Close the schools. It's not that easy. It's not that simple. Close the schools. For many families, the school is childcare. If you close the schools and the children are home, a large percentage of the workforce may say, I have to stay home and take care of my children. There are school districts that are in wealthier parts of the state where the family is in a position where one parent stays home or where they can hire a caregiver to stay at home. But then there's everybody else, right? I'm from Queens, New York. I grew up in a very working class neighborhood. Most families don't have a caregiver at home. If the children stay home, one of the parents have to stay home. If there's only one parent in the house, that parent has to stay home. Yeah, but we have essential workers who need to go to work. Police people, fire officers, healthcare workers, again, because we said this is all about the capacity of the healthcare system. We can't have 1199 healthcare workers not coming to work because they have to stay home. We can't have nurses staying home because they have to stay home and watch their child. So it sounds simple, it's not simple. You close the school, how do you feed the children? For many children, the breakfast and the lunch are the two main meals they get, and they get that at the school. How do you distribute food to all these children who are now not in school? So those are very real concerns. If you can address those concerns, address the negatives of closing the schools, then yes, close the schools. Why? Because it's totally in line with our density reduction, et cetera. These concerns can be addressed, and it's up to the locality to come up with a plan to do it. We're speaking to Nassau, Suffolk, and Westchester. County Executive Laura Curran, County Executive Steve Ballone, Suffolk, County Executive George Latimer in Westchester. They're interested in closing schools. We said closing schools if you can reduce the negative, child care, et cetera, student meals, then I think it's a good strategy. But we have to address those two negatives. The worst negative is if we lose essential workers. Police officers say I can't come to work, firefighters say I can't come to work, public transportation operators say I can't come to work, and most dramatic impact, hospital workers. Because remember, the hospital workers, there will be hospital workers who get sick. That's going to happen. That will reduce staffing in hospitals. That has to be factored in because you know that's going to happen. So given that, you want to make sure you're not artificially making that problem worse. Jim Malatras is going to be working with these counties to try to put together these situations that would take care of the negative consequences of closing schools, which would then facilitate the closing of schools. Ongoing operations, just so we sum up, we're doing testing. We've made great progress there. Thank you, Vice President Pence. Thank you, President Trump. We have more to do. Density reduction, which is what we've been talking about. School closures, and taking care of the negative consequences that might happen is an ongoing function. Hospital capacity, hospital capacity, hospital capacity. and tracking of the cases, mapping of the cases, identifying the clusters, so we deploy our resources. The numbers today, total tested is up to 5,272. As I've said every day, the more you test, the more positives you will find. New cases, 442. I'm sorry, newly tested, 442. This is just testing data. 5,200 tested, 442 tested since last evening. Is that correct?
Yeah, so far this morning.
So you see how fast, we were only doing 200 tests per day. We now did 442 since last evening at about 6 o'clock when we did the last briefing. Positive cases, 729. New cases, 69. New York is the state that has the most number of cases. Again, you would have to correlate that to how many tests the other states are doing, because the more tests they're doing, the more cases they will find. We've had 3 deaths. We had an additional death since we spoke last. A 79-year-old woman who had multiple major underlying health issues and had the coronavirus and succumbed to the coronavirus. Current hospitalizations, 137 out of 729. That's 19% of the cases. This number relates back to hospital capacity. 65 patients in ICU already. This is against the number of beds available in ICU units. And you can see how quickly these numbers move. 46 patients intubated. Again, perspective, because we're fighting the virus, we're fighting fear. The fear is winning, and the fear is disconnected from the facts. Fear is an emotion. Emotion can often be disconnected from facts, and that's what's happening here. But this tracks all the cases that have happened since China. 156,000 cases, 5,000 deaths. You look at the people who have passed away in the state of New York, the 3 people. Those are people who may very well have passed away from contracting the flu, right? Every year, tens of thousands of people die from the flu. We say they died from the flu, but they very often they were battling cancer. They had heart disease. They had emphysema. And then the flu, on top of that underlying condition, was the straw that broke the camel's back. I did an open letter to President Trump today that made 3 points. It says, we know what is going to happen because we have the data and the projection. Look at China, look at South Korea, look at Italy, and just plot the numbers. You know the curve. You know how effective you are at flattening the curve, and we are now looking at a wave. And we know it is a wave. Do everything you can to reduce the wave. We are. It's still a wave. It is going to be a wave. And it is going to be a wave that at any of these projections will overwhelm the healthcare system. I asked 3 things. 1, on the testing, and I'm grateful that he approved the New York testing capacity. FDA has to get out of the way on the automated testing capacity. Let us approve automated testing companies. It can't be 1 or 2 companies are the only companies in the United States doing this. You need hundreds of thousands. Accelerate the testing. Second, the federal government has to provide help and guidance to states on what to do and when to do it. This can't be a national policy of every state does its own thing. You can't have a patchwork quilt of policies. New York State closes stores. Okay, New Jersey doesn't. What did I do? I just sent thousands of vehicles over to New Jersey, flooding New Jersey stores. New Jersey closes stores, and I don't. What did they do? They just sent thousands of New Jersey people to shop in New York and then go back to New Jersey. You cannot do this ad hoc, one state at a time. Make a decision, tell the states, this is the decision, and then let's go. Closing schools. If you think schools have to be closed, well then help us. Where do we get the childcare? Where do we get the meals? Where do we get the money to provide the meals? There are ways to do it. We could just increase what's called the SNAP program, the food assistance program to a family, and say, you know what? Your food assistance payment is going to go up 50%. You buy Johnny breakfast and lunch. But we have the federal government that is integrally involved in that. Help us plan and help us coordinate, and don't pit one state against the other inadvertently by having them come up with different policies. That's the second point. The third point is this. You're going to need more hospital capacity. You're going to need more facilities. You're going to need ways to free up those 53,000 beds. You're going to need to construct or retrofit physical buildings, acquire thousands of pieces of equipment like this. The state can't do that. I don't have that workforce. I don't have the resources, but even if I had the resources, I don't have the physical capacity to turn SUNY dorms into hospitals in 3 weeks. I can't. There's only one workforce that can do that. It's the Army Corps of Engineers and the military assets. That's what they do. They build bridges, they build camps, they have tens of thousands of personnel, trucks, equipment, excavators, logistical managers, purchasing power. Use them to come in right now, identify existing facilities that can be retrofitted, and use them to do it. China built dozens of hospitals in literally like a month. How? The Chinese government came in and said, we're going to do this, we're going to nationalize it. South Korea, the same thing. You can't leave it to the states. I can't do it. I do not have the resources or the capacity. And by the way, I'm an aggressive governor. I push very hard. But there's no way that we could manage this undertaking. The Army Corps of Engineers, I used to be in the federal government. I've worked with them. They're amazing. Their capacity is amazing. And what better time to use those resources than saying, let's get to work, let's retrofit buildings, let's purchase the equipment, let's use that massive logistical machine of the military to actually save lives. It makes all the sense in the world, and by the way, we have no option. We have no options. You know what management is? Pick the best option. My expression to my colleagues, what are my options? Well, You have none. There's only one. Okay, I pick that option. You have no other option. Otherwise, we will be sitting here 9 weeks, 10 weeks, 14 weeks from today, seeing a healthcare system overrun. We will be saying, we knew this was going to happen. Why didn't we provide more health care facilities? Why didn't we do everything we could to make that a reality? Doing everything you can to make that a reality means bringing in that Army Corps of Engineers and that military expertise. And I hope the President takes me up on it. With that, questions, comments, any points I left out to my colleagues here?
One other thing that we're starting tomorrow is the DMV is going to be moving to appointment only so that we keep crowds out of the DMV. You can do that online, or if you don't have access online, you can go to the DMV, make an appointment, and then come back.
So Governor, based on everything you just said, does it make sense to bring the legislature back here this week with their staff, hundreds of people at the Capitol, when you're saying even businesses should possibly close or work from home?
Government is an essential operation to manage this situation. To me, that's like saying, in a war, when people might get killed at war, does it make sense to send soldiers?
But do they have to physically be here this week? I mean, there's other things you could do. Close the Capitol for a couple weeks.
Karen, there's no couple of weeks here. There's no couple of weeks.
Should you do a budget extender till, say, June? You've said that you don't know what the state's finances are.
Look, should the Congress not show up? Should the military not show up? Should the police officers not show up? You're asking nurses to show up and do their duty. You're asking nurses at these drive-through testing facilities like in New Rochelle, show up and do your duty, which is to help the public health and put on a hazmat suit and take blood. If we can ask nurses to put on a hazmat suit and take blood, we can ask elected officials to come sit at a desk and vote on a piece of legislation.
Governor, there's a difference between healthcare professionals and lawmakers. I mean, up until last week, we were all here, we covered the legislature. There was no social distancing implemented whatsoever. So how is this week going to be any
They should
different?
take all the precautions. But Bernadette, I need them to authorize the laws and the measures that we may need to do this. You need soldiers to fight the war. Government must function because government is doing all of this. Government goes home, none of this happens.
Governor, do you feel New York City should be shut down? There's growing calls to have bars, restaurants, gyms, et cetera, closed mandatorily. How do you feel about that?
Well, when you say New York City shut down, are you talking schools, businesses, or streets?
I'm talking entertainment, social gathering spots, bars, restaurants.
All right, because there are gradations, Jesse. We started closing down, if you will, businesses with our 500 gatherings and 50% of occupancy. That is closing down businesses, gathering places, et cetera. So we have started that.
Yeah, but there were reports everywhere last night that bars were full, restaurants were full, people weren't abiding by the reduction.
Well, then they're violating the law if they're doing that, and then the NYPD should come in and shut them down, right? Now, if your question is, should we get more aggressive in the shutdowns? That's something we're looking at. And you look at those numbers every day, and there's a knob, and you turn the knob higher or lower, depending on what you see. If, and I've heard what you've heard, if people are not enforcing the law, or if the numbers are continuing at a rate, then yes, I will get more aggressive on the mandatory regulations. I'm asking them today voluntarily close down. voluntarily close down your bar, your restaurant, your gymnasium. Let's see what they do. If nobody does it, then we can take more actions. By the way, at one point, people actually react reasonably and responsibly. And people say, you know what, I'm not going to go into a bar with 100 other people bumping up against me because it's too high a risk to have a martini. I can have a martini at home.
Governor, could you clarify what you might want them to do as far as a state budget if they come back this week? Would you want them to do it this week? And to what extent would that spending plan be? Bare bones, medium bones, the full
I want them
regular
to
budget?
I want them to do their job.
Do you want it done this week?
I want them to do their job. I want the U.S. Congress to sit in there and do their job. I hear you. I want the judges to sit in there and do their job. I want my team to do what I'm doing, which is sit in here and do my job. This is why you are in government. This is why you're here. If you didn't want to be here, you shouldn't have run for office. You shouldn't have you shouldn't have sought out a public service job. If you didn't want to fight the war, you shouldn't have enlisted in the military, okay? If you didn't want to do a public service at a time when you have a social crisis, then you shouldn't be here. You made a mistaken career. If you didn't want to help sick people, you shouldn't be a nurse, right? If you wanted to stay away from alcohol, you shouldn't have been a bartender. That's the essence of what we do. This is the essence of what we do. There is no higher, more necessary, purer form of public service than what we're doing right now. This is it. Do your job.
Are you offering any guidance to legislators about closing their offices or bringing staff up?
Legislators are people. I'm offering them the same guidance I'm offering everyone. Social distancing, be smart. Your elected officials, be smart. Like a business owner, like my kids, like my neighbors, like everyone.
Several state lawmakers who are older, some of whom may have underlying health conditions, should they be putting their health at risk, come to Albany to do their legislative work?
Should the state workers, should nurses be putting their health at risk? Should doctors be putting their health at risk? Should OGS employees be putting their health at risk? It's not like they're working in a hospital or taking blood. They're working in a state capitol, reading paper and passing bills.
Right, just to push on this for a second, you're talking about bringing, let's say, 100 Democrats into a small conference room from all over the state.
So go in a bigger room.
And then dispersing back to their communities. Doesn't that seem to be like the very definition of how you spread the
Then
disease?
be in a bigger room. Look, you're bringing the U.S. on that theory, Jesse. No U.S. Congress, no U.S. Senate, no military operation. I mean, you'd shut down everything. No New York Times.
If I could just go back, do you want the budget done this week? Is that what you're?
No, it's April 1 is the deadline.
Can you issue an executive order to maybe make them, or have the legislature vote remotely? Is that possible? Have you thought about that?
I have not thought about that.
Is that a possibility?
I don't know if it's legally a possibility. Why are we so worried? I know the self-interest here because they're in this building, I get it. But everybody is going through this, everywhere. They're not doing a high-risk occupation, right? Well, politics today could be considered a high-risk occupation. But yes, they could come here, do administrative work. We're having people, the reason I have difficulty with this concept, I mean, I'm having people go into hospital emergency rooms. I have people going to people's homes to take blood from people who believe they're positive. Compared to what we're asking people to do in public service, I mean, this is not even in the same category.
Implemented social distancing rules like the 500, half capacity, et cetera. But again, you have thousands of people that come into the state capitol every day.
We're closing it to visitors.
Right, but people have been coming in for the past 2 weeks.
Yeah, but people are coming into every building. Yeah. You have 2 corporate executives in every office building who are sick. You've had hundreds of people who've been walking into the New York Post for weeks. You have people in the New York Post who are positive. I mean, otherwise you just shut down everything. And take a deep breath. People are going to get sick. Many, many, many people will get the virus. 40% of the population, 50% of the population, 60% of the population, 80% will self-resolve. We're talking about that vulnerable population, senior citizens, immune-compromised, underlying illness, like the people who have passed away so far, like people who pass away from the flu. The operational problem is they're going to overwhelm the ICUs. That's all we're talking about. You have to take a deep breath. We're not talking about the Ebola virus here. And you're reflecting, frankly, the same level of anxiety that people, by and large, are reflecting. No, don't panic. Don't shut down everything. And don't shut down the operation that is responsible for handling the situation.
I'm just going to try this one more time. It just seems like you're giving us contradictory information here. You can't have more than 500 people together. You want businesses to close.
In a dense location.
There will be 500 people.
Well,
in this
then,
building.
no, not in a building.
In this whole complex and the assembly.
No,
chambers
it's
and everything.
50% of occupancy rate of this building. The occupancy rate of this building would be in the thousands.
I'm a little confused with what you just said. Are you going to limit occupancy of people who work here?
No. You said it's inconsistent with the regulation I passed. My regulation was 50% of rated occupancy for a room, right?
Please comment.
The Congress is up. You want to close down the Congress? By your reasoning, you'd have to close the Congress, you'd have to close the Senate, you'd have to close the White House, you'd have to close all the federal agencies.
Would it be bad if maybe say the Congress or any of those bodies limit the time that they're there to just very essential things?
Well, what's not essential that we're talking about today?
Can we just go back to your reminder of April 1st, and I'm hearing that lawmakers are being told to focus on being prepared to pass the budget the weeks ahead.
You want to pass it early? I say great.
Is this a skinny budget, do you think, or are you throwing out big ticket issues like surrogacy, vaping, things like that, and just keeping the lights on, or are you still working towards deals on those?
As I said before, it doesn't go skinny fat. I would not rush an issue that we're not ready to do, right? I don't want to pass or sign a bad piece of legislation that is not thought through. So if there's a complex issue that is not thought through, fine. But the 99% of these issues are fully thought through. Everybody understands them. It's yay or nay. They just don't want to say yay or nay because they're controversial and they're difficult and they're 50-50 issues or 60-40 issues, so they don't want to take a side because then they're going to take the political heat from the other side. But on those issues, say yay or nay.
Last question. Do you think they should still stick around after the budget is passed through the scheduled session, or after the budget is passed?
I think they should do their job, yeah. I think they should do their job.
On the issue of the federal intervention, what would this look like? And what is the goal with like the Corps and the Army coming in? So would they be taking state buildings and converting those into hospitals? What do you imagine that looking like?
This is what I worked with the Army Corps of Engineers when I was at HUD, and we actually used them to build housing on Indian reservations, Native American reservations. I have SUNY dorms. Come in, take my SUNY dorm, retrofit it for a medical facility. And then I'll contact medical schools and nursing schools, and I'll find excess people to come staff that SUNY dorm. What federal facilities do they have available that we could now convert? So we have properties and buildings, right? I have colleges. I would do any of these buildings. I just don't have the physical construction capacity to organize that. You know, government doesn't build. My government doesn't build, right? We contract out everything. And for us to contract out, you need a design, you need a plan, you need an RFP, and then you have to be able to pay for it. The only government that builds is the federal government.
And how many beds would you like to create?
Well, I'll ask Dr. Zucker, what do you think the capacity differential could be between the number of ICU beds we have, 3,000, by the way, 80% of occupied of the current ICU beds. So even if you had beds to get some of the people out of the ICU beds, right? Because if 80% are occupied of 3,000, that means we only have 600 beds. We just said, how many are in ICU beds so far? Yeah, but how many did we say are in ICU beds?
We have 65 in the ICU.
65. So we have 65 today, and we only have 600.
So how many do you need?
Yeah.
Well, I think this goes to the modeling that we're working on to try to figure out the spread of disease, the period of time, as the governor mentioned about the issues of flattening that curve. That will help us determine how many you need, because you don't want to have all of them at one time. If you flatten that curve, you can spread that over a period of time. And we have a team trying to model that out, and then I can answer your question more directly.
I would say this, non-scientific based answer, which I would not rely on because I rely on the good doctor in science. My number, you need thousands. You're going to be thousands short.
Of ICU beds.
Thousands.
Thousands of ICU beds.
Thousands.
Governor, have you spoken with federal officials?
Now, and has it had any success in trying to purchase more?
You cannot purchase more ventilators. We have several thousand.
Enough for every ICU bed at this point? So
The ICU beds have the ventilators. We have 3,000 ventilators.
Consider how many,
You could use thousands, you will need thousands of more ventilators.
Could you,
Scary.
Yeah.
Governor, could you please expand on what you mean by non-essential services for the court system? What do you think that wraps into?
Arraignments have to happen, child protective services have to happen, family court emergency orders has to happen, non-essential motion practice, motions that you could hear later on, civil matters that you could hear later on. I'll leave that to the chief judge, but anything that is public safety is essential. Anything that is criminal justice is essential, but any matter that is not time sensitive, that is about money recoveries as opposed to a more imminent need, let the chief judge make those decisions.
Federal officials about the potential for domestic travel restrictions in and out of
Nope.
New York?
What's the numbers? I couldn't see on the board for New York City. What are the new totals now?
Not that one. New York City,
329. 29.
And also, what more can you tell us about the new death? Where was this individual, what county, and what hospital was she treated at?
Sure. So there was one individual who was an elderly person that was identified yesterday who had multiple medical conditions, and we're getting more information about that. But that person was in a New York City hospital.
Do you know which hospital?
We usually don't like to give out the hospital names.
Yesterday, Mayor de Blasio said Wyckoff Medical, so.
Well, there are three deaths that the governor mentioned, 2 yesterday and then the 1 today. One of those was the others are also with many other medical conditions as well.
Okay, so 3 deaths total or 4?
There are 3 deaths total, yes.
3 deaths total. Okay.
And
2
the
yesterday and 1 today.
The 79-year-old woman today was in New York City, is that right?
Died in New York City.
Died in New York City.
When was she first admitted, or when did she die?
She died today, and she was admitted within the past week. I can get you the exact date if you want.
Is there difficulty also between, because I know there was some discrepancy with Rockland County and getting that information over to the state. Is it difficult for county health examiners to report and identify deaths related to the virus and then also transferring that information to the state? Is that sort of a slow?
No, they're not so. The reason that was different was it wasn't identified until the autopsy, which is a different scenario. And that was the delay. It was identified in an autopsy. And again, these numbers, they're coming in now at such frequency, depending when you have the person sit down to make the chart. By the time you finish writing the chart is no longer accurate, right? So that's why you get a little bit of a variance. Last point, I just want to stress, you need 1,000, in my opinion, not science-based, you will not be able to flatten the curve to avoid the wave. You will be short thousands of ICU beds, thousands of ventilators. The only way to prevent that today, given this time constraint, is to deploy the Army Corps of Engineers and use that capacity to retrofit existing facilities to free up hospital beds. A decision is easy when you have no options. And here, this nation has no option. I sent the President a letter. That is a very rare occasion for me. I said to the President in the letter, I offer these suggestions as a governor, as a former cabinet secretary member, as a person who knows how the state government works and how the federal government works. This is the state that has the highest number of cases. I said to the President in all sincerity, there's no place for politics. I'm not playing politics. I don't give a darn, Democrat, Republican, whatever you are. This is about Americans protecting Americans' lives. And I will work in full partnership with the President on this issue 100%. But I ask him personally to take this seriously. I know it's a dramatic action. It may be an unprecedented action. This is a dramatic time and an unprecedented time. And great challenges require great leaders and great solutions. And that's what this is. Thank you very much.